I'm a radiation oncologist. We are here at Virginia Commonwealth University, and we're going to walk you through the linear accelerator, a patient setup, and image verification.
My name is Laura Padilla, and I'm a medical physicist.
And I'm Benjamin Smith, a radiation therapist.
Today we will give you an overview of a treatment room and a general overview of the radiotherapy process. Behind me is a linear accelerator. This particular one is a variant Trulian. Although different linear accelerators may have a different look, they all have all the same general parts. So right here we can see a treatment couch or treatment table. Up here is a gantry. This is the collimator, and on either side you can see the imaging arms. The ones that are lateral are the KB imaging arms, and the one that is below is the MV imaging panel. We will rotate the gantry to 90 so you can take a closer look at the collimator.
As the gantry is getting in position, we'll be able to see one of the features we use to help shape the radiation therapy beams, or what's called MLCs, or a multi-leaf collimator. As you can see, the collimator can rotate around, and the MLCs are inside, which would shape the beam to such fields like this.
In order to get the patient set up in their treatment position within the linear accelerator, they're positioned on the table, and then the table is moved in various directions. The table can move up and down. It can move longitudinally or closer into or away from the gantry. It can move left and right or laterally, and can even rotate if need be. Once the patient is positioned well, the lights are turned off so that you can see the lasers. The lasers are then lined up with the tattoos or marks that are placed on the patient at the time of simulation to represent the isocenter. Now we will pull out the MV imaging panel to take our first portal film.
To demonstrate the imaging capabilities of the treatment machine, we have a head phantom positioned on the table. So here you can see the MV image that we acquired. MV images are usually used for treatments that are not as complex as IMRT, so treatments like 3D conformal. They allow you to take an image at any of the treatment angles, so the gantry can be at any angle and you can still take the image. And it also allows you to check the field aperture. So if you have a field that is shaped like a circle, like here, with the MLCs, as we discussed earlier, it allows you to take an image of what the open field actually looks like, the open area of the field. So you can check if the anatomy that is being irradiated is actually the anatomy that you're expecting.
Now we'll pull out the lateral imaging panels to take our KV imaging. Typically, one image is taken from the lateral plane, and then the gantry will be rotated to take an AP.
Here we have taken some KV images for patient setup. These are orthogonal images. As you can see, we have an AP, PA one, and a lateral, whether it's right or left, doesn't really matter. For the AP or PA one, you can shift superior, inferior, and laterally. For the lateral KV image, it allows you to also shift superior, inferior, but this time it also allows you to shift anterior, posterior. So it gives you the opportunity to set up the patient in all three directions. So what you would do is you would look at the DRRs, which are the images that you obtain from the planning CT, and you would compare those to the KV images. And that's what you use to set up the patient so that they match the treatment position as expected.
And why are the KV images so important?
KV images are important because they give you a really good contrast of bony anatomy, so they allow you to see the anatomy more clearly and be sure about your setup for complex treatments.
So what's the difference between MV and KV image quality, and when would you use one versus another?
So as you can see, the MV image quality is not as good as the KV. So this is what the KV image looks like. You can see a lot of detail and you can see a lot of contrast. This is taken with the same energy photons as what you see in diagnostic imaging. So it's in the hundreds of the KVs. And then this is taken with the treatment beam. MV images are taken with the treatment beam. So this is a 6 MV beam, which makes the radiation interactions that occur that lead to the images a little different. So you end up with an image quality that is not as clear.
Now we'll take a cone beam CT. This uses the KV imaging panels and requires a full rotation of the gantry to get a 3D picture of the patient's anatomy.
So now we've acquired a cone beam CT. As you can see here, we again have the KV arms out. The difference between just the planar KV images and the cone beam CT is that the gantry rotates as the images are getting acquired. So the software is able to reconstruct the 3D image set of the patient. The image quality for the cone beam CT is not as good as for the regular simulation CT that you usually see. And the field of view, so the anatomy that you can actually image, is also reduced. So if you look at this view, which is the coronal, you can see that we can see less anatomy with the cone beam CT than with the planning CT. Usually cone beam CTs are used to check the patient's internal anatomy. So it gives you a 3D view of what's going on inside of the patient. So if there are tumor changes, if there are just normal organ anatomical changes, differences in the bladder filling, all those things are really easy to see in a cone beam CT. So you would do the same thing as with the other images that we've already looked at. You would compare the image you acquired in the treatment room to the image that you use for planning, so the image you acquired during simulation, and you would try to match the anatomy as closely as possible. With the cone beam CT, you can also see rotations a lot more easily than with the KVs. So you can see how the head is moving slightly here.
Show me that again.
So this is where the patient is right now, and this is where it was simulated. So you can see a slight rotation.
And how do you describe the types of rotation?
There are 3 rotations that you encounter. There is the roll. So essentially, if the patient is laying on the table and you just look at the head, if you picture the patient saying no, that would be the roll. So it's the rotation along the longitudinal axis. If you picture the patient laying on the table saying yes, that would be the pitch. So it's the rotation along the lateral axis. And then there's the yaw, and the yaw just matches the table rotation essentially. So it's a rotation along the vertical axis. So to clarify the rotations that we were discussing during the imaging portion of the video, I just wanted to show you guys what it looks like with the phantom. So this rotation right here, that would be the roll. This is the pitch, and this is the yaw.